And here to break it all down for us, we turn now to Allison Michaels of the Washington Post. She hosts their weekly podcast, Can He Do That?, which focuses on the Trump administration. Allison, good to see you.
Thanks for having me. Glad to be here.
All right. The health care bill now heads to the Senate. Hospitals and doctors and insurers have all come out against it. Explain the most significant changes that we are expecting senators to make, especially concerning pre-existing conditions and, of course, Medicaid.
Yeah, so what we'll see is essentially the Senate will basically likely scrap the American Health Care Act and kind of start from scratch. So we have a couple of things at play. We have, the panel of 13 senators who are going to sit down and come up with a plan. But what we also have is alternative plans entirely from Senators Bill Cassidy and Senator Susan Collins. They've completely come up with a plan as well. So in terms of specifically Medicaid, we'll probably see something that represents what Ohio senators and West Virginia senators like about the bill, which is the Obamacare Medicaid rollouts, which have existed prior to now, which exist as a result of Obamacare. So, they don't want to see those go away. And in terms of pre-existing conditions, we're going to want to see coverage. The senators, rather, are going to want to see coverage for pre-existing conditions. They're not going to want to see that rolled back. So they'll probably make sure that that's added back in the bill, not through what we see now, which are high-risk pools that exist in the current American Health Care Act.
Allison, the Congressional Budget Office has yet to weigh in on how much this bill will cost. Back in March, the office revealed that 24 million people would lose insurance under the original bill, and that caused moderate Republicans to shy away from it, caused a lot of headaches for so many people. Do you see that happening again once the CBO does weigh in?
So Senate budget rules require that basically a piece of legislation needs to prove that it does not increase the national deficit after 10 years. So they'll need to see a Congressional Budget Office score before they even move forward on voting on this. So it's very important that, that score comes out. Now, moderate Republicans, we thought that they necessarily weren't going to vote in favor of this bill after the initial Congressional Budget Office report that said that 24 million people were likely going to lose coverage, but pressure from the White House and pressure from Paul Ryan kind of pushed them in that direction. So right now it's kind of unclear whether or not they actually will reach that point in the Senate where moderate Republicans aren't necessarily swayed by a Congressional Budget Office number that's very big.
All right, a lot of Democrats are saying the fight ain't over yet. How will this debate impact the 2018 midterms?
Yeah, so this is a big one. In 2010, lots of Democrats lost their seats as a result, mostly because of Obamacare. So we saw that happen in 2010. It's likely that we might see something like that happen again here. You essentially have Cook Political Report, which has come out and said that 20 races, which might have been leaning Republican in the past, are kind of toss-ups or somewhere in the middle. So it's going to be very, very hard for Republicans to fight against a Democratic message, which is that these particular representatives voted to cut health care from 24 million people, to cut coverage for people with pre-existing conditions. It's going to be a hard message to fight against.
All right, I want to switch gears now if we can. The investigation into Russian meddling in the election continues, of course. A former acting Attorney General Sally Yates is expected to testify before a Senate Judiciary Subcommittee on Monday. What is her testimony likely to center on?
So as you probably remember, in February, Michael Flynn resigned after he was allegedly having phone calls, which were later confirmed, with Russian Ambassador Sergei Kislyak. And in those phone calls, he had said repeatedly that he had not discussed Russian sanctions that were placed on Russia after interfering in the U.S. 2016 elections. So after that conversation, it later came out, the Post actually reported that, that those sanctions were in fact discussed in those phone calls. So at the time, Sally Yates had talked to White House counsel Don McGahn and told Don McGahn that, there was some alarm to be raised here. Now, the White House has repeatedly said that Sally Yates merely gave them a heads up. But in reality, what happened was that, or what is expected out of Sally Yates' testimony is that she's going to tell them that she actually did raise red flags, that she raised alarm, and that she said this was significant cause for concern. This will be the first time she has spoken publicly about that White House conversation.
All right, Allison, President Trump has had a contentious relationship with the courts. No secret there. Your podcast this week focuses on whether Mr. Trump could hypothetically break up the Ninth Circuit Court of Appeals. That's the court that blocked his travel ban orders. Allison, could he do that?
So this is something we addressed this week on the podcast, and it's interesting. He actually cannot do this. He cannot do it without Congress, but there are two options that he has. So one would be to essentially get the public to rally around him and increase his favorability so that people really would support his attempts to kind of discredit some of the decisions that the court is making to put pressure on the courts. If he had enough public pressure on the courts, that might sway potential decisions. But the other option that he has in terms of actually breaking up the court would be for Congress to pass legislation that would go ahead and do so. The problem with that is it's generally very frowned upon to do something like that, which would seem like a political reaction to a court disagreeing with some of the decisions that the administration was making. So that's something that would be extremely unlikely, especially in this political climate, but could potentially happen down the road in an attempt to kind of have a good governance appeal to something like breaking up a court that was too busy or had too many administrative cases.
All right, a final topic for you. Let's go ahead and talk about the French presidential election if we can. Centrist Emmanuel Macron is leading in the polls over far-right candidate Marine Le Pen, of course. What will those results mean for the United States?
So what we're seeing there is a, really anti-globalist candidate who is running on a France First campaign, very similar to what we saw here with President Trump. So, that is affecting her statements that she's considering withdrawing from Europe, things like her relationship with President Vladimir Putin. All of those things could eventually contribute to a plummeting euro, which would affect, the international economy. So I think first and foremost, we're seeing kind of this movement towards anti-globalist leaders that would be an indication that what's happening in the U.S. is happening abroad. And we also might see effects, on the cost of U.S. goods abroad as well.
All right, Allison Michaels, always good to see you. Thank you for joining us.
Thank you.